Hi, everyone. My name is Dr. Rita Roy, CEO at the National Spine Health Foundation, and I'm your host for the Get Back to It podcast, where we tell real stories of healing and recovery. What does it mean to get back to it? It means overcoming spine conditions through treatments that work in order to return to the people and activities you love, whatever that looks like for you. It means getting back to your life. We're here to share the success stories of those who did just that. And some of these stories you are not going to believe. At the Get Back to It podcast, our goal is to tell stories of spinal champions who've been able to achieve a better quality of life through spinal healthcare. In today's episode, I'm delighted to be speaking with Emilya Semchuk, who was diagnosed with scoliosis after a school nurse noticed a curvature during a scoliosis screening. After enduring much discomfort from elementary school throughout most of her 20s, she finally decided to have scoliosis surgical correction and is now living her life with significantly less pain and enjoying all the activities she loves. Now that you know what to expect, let's get back to it and dive right into Emilya's story.
I believe I was in upper elementary around the year 2005 when a school nurse noticed that I had a curvature in my spine during a scoliosis screening and referred me to see my physician. My physician referred me to a specialist, and I was diagnosed then with idiopathic scoliosis.
Emilya's scoliosis quickly progressed, and by the time she saw a specialist at Seattle Children's, her condition was already considered severe.
I was told bracing would no longer be an option for me, and I was advised then and there to undergo spine surgery. I had seen a few chiropractors, but the treatment they offered did not seem to improve the curves in my spine, so I scheduled the surgery around the year 2009.
Emilya ended up not going through with the surgery and continued to occasionally see chiropractors. Increasing pain and discomfort in her mid-20s, however, led her to reconsider the spine surgery.
At the age of 29, I made the decision to undergo a spinal fusion on January 8th, 2024. And I have been in recovery ever since, increasing my physical activity and going to physical therapy.
Emilya began to ease into her normal activities and went back to teaching 2 months after her scoliosis surgery. Emilya, your story is so important because it shows what success can happen with a good action plan and perseverance. It must have been very scary when you were in elementary school and you were told that you had scoliosis and what that could mean for you. Can you remember what that time in your life was like?
It definitely was confusing and scary. Those are good words to describe that. I don't remember meeting anyone around me with the same condition or same story as me, so I didn't have anyone to ask questions.
Or you felt alone with that diagnosis?
I did, yeah. And when I think back to that time, it does feel like a blur. I don't remember all the events unfolding very clearly. It does feel like a blur, but I definitely don't remember there being a lot of positive feelings around this diagnosis or just the start of my journey. It was confusing. It was a scary time.
About how old were you at that point, Emilya?
I can't recall exactly, but I think they did the screening around 4th or 5th grade. So it was upper elementary. I think I was 9, 10, possibly 11. Yes. It's around there. And that was just the beginning. So I don't remember ever like looking at myself in the mirror and seeing a difference. It was just something that was spoken. So I couldn't quite like look at myself and think, oh yeah, I do see what they're talking about. I remember it just being such a mild curve.
Very subtle.
Yeah,
very subtle. But that was astute for the school nurse to kind of see that and advise you to go see your doctor about it, right?
Yes, yeah.
So do you remember what the time period was from seeing your doctor and then getting referred to a spine surgeon? What was that time frame?
I don't know why it's so hard for me to remember the time frame, and my parents as well. It just all was such a blur. And it was such a long time ago. But from somehow between the time of getting diagnosed and then seeing a specialist, it was already severe scoliosis. So I don't know what happened in that time. I guess my body just quickly grew and changed, and the curves got worse. Yeah.
And so at that time when the surgeon recommended surgery for you, what were your feelings? Was there hesitation or confusion, or what were some of that? Or did you decide that you would pursue that, but then you didn't? Tell me what that was like.
There was a lot of hesitation. My family was extremely supportive, but ultimately, I think because I was around, I don't know, was it 15, 16? I don't quite remember how old I was, but because I was around that age, they kind of just left that choice up. They thankfully left that choice up to me. And as I thought about it, did my own kind of research that I could at the time, I didn't know if that was the best decision for me at that time. So I did schedule the surgery and then I backed out of it. And I actually don't remember how much time had passed. I just know that it wasn't in the books. It was scheduled to happen and I just backed out for some reason.
Yeah, you just weren't ready. And tell me what the feelings that you had. Did you have pain in your back? Were you uncomfortable? Was the scoliosis preventing you from doing anything you wanted to do?
Now that you ask that, or now that you talk about pain, I guess because I actually didn't experience much pain, I thought maybe this is something that I can adapt to and live with. Yeah. So I don't remember there being a lot of pain at that point in your life when you have a physical difference. It affects you emotionally. At least it did affect me mentally and emotionally.
Sure.
Just even at the beginning of the diagnosis, because you don't want to be different. You don't want to, you want to look like everyone else, in your age group. So I remember more than anything, it was difficult for me to come to terms with that in my mind, that, my body looks different, clothes fit differently. A couple people would notice at school and make some comments about it. And it was, so I don't remember feeling a lot of physical pain at that time, thankfully. It was more the emotional and mental
anguish,
experience.
Really. Yeah.
That too, yeah.
Well, the mental health component of having a spine condition is very real. We talk about that a lot in the foundation, and particularly when it comes to adolescent idiopathic scoliosis, for exactly the reasons that you say, that, kids are trying to fit in and, create a friend group, and you don't want to be, the odd person out, and especially not for a physical abnormality that you can't control. It's not like you can cut your hair, or wear some makeup, or there's nothing you can do about it. It's something that your body is doing that you're not in control of. And that's really tough, for teenagers, for anybody, especially for teenagers.
Yep. I know exactly how that feels.
Yeah. Emilya, what was your physical appearance like? Was it very obvious at that time in your teenage? Were your collarbones uneven, or describe to me what you saw in the mirror, when you looked at yourself?
Yeah. definitely a physical difference. So my hips were misaligned. My shoulders were uneven. The left side of my lower back, there was a obvious rib hump. Just everything. It was from the top to the bottom of my back. Just everything was asymmetrical.
Wow.
So I think anyone who looked at me from the front at that point could see that there's something off. But then, of course, from the back and from the side, they definitely were able to notice. And as time went on, my body sort of settled into something that was less obvious from the front. And it was only when I wore tight-fitting clothes that you could really see my scoliosis. But it was definitely there, and I was fully aware of it always. But I think when you're younger, everything is still changing. So a lot more was obvious. If that makes sense. Yeah.
And somehow when you're younger, you tolerate things, right? You're like, well, this isn't that bad. This is going to change. It's going to be better. It's going to be okay. It's a temporary thing because your body is going through so many other changes as well. Yeah. Emilya, tell me what kinds of activities you did as a teenager.
As a teenager, I was your average teen, I'd say. I didn't play any sports. I believe I physically could. And if I could go back, I would talk to that young girl and say, hey, don't let anything stop you. I definitely physically could have, but I just somehow let all of this prevent me from taking risks and trying things that I thought would feel difficult in the moment. So I didn't play any sports in school, but I loved being active. I loved being outside. I enjoyed traveling. Actually, like what I enjoy now, it didn't change. I'm just discovering even more about.
Even more. Yeah.
Yeah.
So the good news is that the scoliosis in your teenage years didn't prevent you from living a normal teenage life. Perhaps you didn't participate in some things because you just didn't think you could. But maybe that would have been the case with or without scoliosis, right? It's hard to know how you would have felt about that.
That is true. Yeah.
And do you live in a cold or warm weather environment? Or
I
did
live
you?
near rainy Seattle, and I
rainy
have
Seattle.
lived here. Yes, for as long as I can remember. I moved here when I was 3, so this is all I know. We get the best of all the worlds, I'd say. I really enjoy where I live. Yeah.
Yeah, that's so many beautiful hiking trails and ability to be outside and enjoy that temperate weather there. That's really cool. And so life went along for you. You know, the unfortunate medical word that is used for scoliosis is the word deformity. And it's such a hard word to use with young people. 'Cause of course that's the one thing you don't want to have associated is to think that you have a physical deformity. But that is the medical term for scoliosis, one of the medical terms. So as you were going along, you approach your senior year of high school. How was your scoliosis doing and what were you doing about it?
Around my senior year of high school, my scoliosis was still severe, and this was where it actually began to negatively affect me even more. I remember just trying to reconcile in my mind with this is not going away. There's not much that I have done that has helped or decreased even the size of the curves. So it was a lot for me to accept and to experience. Yeah, just knowing that this is my life. This is my story. I don't remember it being in much physical pain at that time. My body was still strong and I was still pretty active, always sort of just stayed strong, fit, active as much as I could. So pain element was not there. I'm sure when I would go on long walks or would try running some distance, then there was discomfort. But in general, it was definitely affecting me emotionally and mentally more than physically at that point in my life.
That's incredible. That's absolutely incredible. And Emilya, were you seeing a physical therapist during that time, or what kinds of treatment were you undergoing?
I saw different chiropractors. I didn't do any physical therapy. I just kept seeing different chiropractors. And they were obviously never able to fix me. There was some relief, and I did have a couple chiropractors that were able to decrease my curves a little bit temporarily. Yeah. But there was never much change. So that was the extent of my treatment. It was seeing chiropractors that could potentially help.
Yeah. And along that way, what were they telling you in terms of how you were managing your scoliosis? What advice were you getting? I
actually always seem to be the patient with the most severe curves that they ever saw. I kind of always keep hitting that record for just different people that I was seeing. I remember almost all my doctors and all my chiropractors, they'd always be like, yeah, you take the spot for the worst scoliosis. So I think I was a surprise to most people who saw me and tried to treat me. And they tried their best, but the story was pretty similar across the board. It was always, there's not much we can do for you. And I did have one incredible chiropractor who would gently encourage me to look into getting treated surgically, because he was able to help me, but at some point there's just so much they could do.
Right.
And if you don't maintain that treatment, then everything sort of comes back. The pain and the curves come back to their original position. So they would always point me in a different direction. I didn't want to hear it, but thankfully on this side of everything, I understand that they did that for my good.
Yeah. Well, it's interesting because the scoliosis, while it was giving you emotional challenges, was really not physically preventing you from living your life, and you weren't having a lot of pain from it. So I could see where it's a little easier to almost be in denial that this was really happening and something that was really happening. Did you discuss the progression of your scoliosis when you went in for your annual physical with your doctor, with your regular doctor, and what did those conversations look like?
So at every physical, I was healthy overall. So this was my only diagnosis, thankfully. And it did come up in conversation every time, but we sort of had the same conversation over and over again. Do I have pain? At the start, it was very, very mild, little to no pain. And then of course things changed throughout the years, but it was always a conversation of, well, it's your choice on what kind of treatment you want to seek out. And I was never pressured to do anything. So the conversation existed, but my physicians were always just,
supportive.
If you're okay with this, then, we're going to just keep an eye on you. So that was the extent of my conversations with them. Yeah.
So tell me, so then, Emilya, what happened after high school? What did your life look like after you graduated high school?
In my early 20s and my mid 20s, things started to change. My pain increased. I remember taking a trip overseas in my mid 20s, and I was walking in these beautiful cities, but I was taking so many breaks and just resting a lot more than the average person my age would need to. And I remember that was one moment where I thought, wow, this is really affecting my life. So life went on, and I tried not to let this stop me, but the pain of having these severe curves in my body, it definitely became a lot more noticeable, and things got pretty difficult. There were times where I would need to stand like as a bridesmaid, or, in just different places where I didn't have the option to just rest a bit. And I remember that just feeling incredibly painful. And of course my body was tired, but again, it was always coming back to that emotional and mental aspect of this deformity is, wow, I don't know why, I need to experience this, but it got very difficult.
Oh gosh. Emilya, did you go to college after high school?
I did Running Start in high school. And right after high school, I waited to go back, and I have gone back in different times in my life throughout my 20s.
Okay.
Yes.
Yeah. So I guess that was the question. I was, were you living alone, or did you, have to make accommodations, for yourself living alone? But yeah, no. So, that for better and for worse, right? You begin to just accommodate your life into the disability that you're beginning to have, so that you almost don't notice the disability until you find yourself in a setting like trying to take a long walk on beautiful streets in Europe, or standing at the altar at your friend's wedding or family member's wedding. And now it's magnified that you're not able to do the things that people your age are doing. Right. And that's a realization that's hard to ignore. Right. And so you got to a point. What was that real turning point? It was sort of maybe a constellation of these experiences that you were having, coupled with actual physical pain.
Do you mean just the turning point for me to consider?
Turning point. Yeah. To say, I need to do something different. Maybe it is time for surgery or treatment or whatever.
It's a great question. I am not sure exactly what happened, but last summer, I just had this moment where all of a sudden I thought, I think this is it. I think it's time. And I had so much peace that came with this decision. It was very interesting. Yeah. Leading up to this point. Yeah, it really is amazing when I think back on this, because leading up to this moment, whenever I would consider scoliosis surgery, I wrestled with this, and it was very difficult for me to make a decision. I thought I would weigh the pros and cons. I would listen to different stories and testimonials and try to understand, is this the right fit for me? And it always felt like such a heavy weighted decision to make. But for some reason, last summer, it was just a moment where I thought, this is it. And I began to do research and look for a surgeon, look for a specialist. And with this sort of change in heart and change in my mind, came a lot of peace. So I was very thankful that I was able to even consider, because I know some people don't even have the option. They might not be candidates for surgery. Yeah.
And you live in a really wonderful part of the country where you have access to great healthcare.
Yes.
Up there in Seattle. Not sure where you had your treatment. I don't know if you want to share that with our audience. You're welcome to do that, or you don't have to either. But
yeah, I would love to share, because this is a big part of my story. I have a friend who had very complicated surgery in New York, and I reached out to her surgeon's office. He's world renowned. I don't know. I'll share his name, Dr. Lanky. I believe is his name. Yeah.
We know Dr. Lenke very well. He's on our board.
Oh, that's amazing.
Yes.
Well, knowing that he is someone who's very respected and just does his job with excellence, I thought I'd reach out to his office and see if they have any recommendations for anyone in Seattle. And they referred me to Dr. Sethi. And that was such a great decision. I am so thankful to.
We love Dr. Sethi.
Yes, I am so
awesome.
grateful
Yeah.
to be cared for by him and his team.
Yes. And I'm sure you met Michelle on the team.
Yes.
And
yes.
She's awesome. Big shout out to Michelle if you're listening.
Yes, I love them. I'm actually going to see them soon, so I'm excited to.
Oh, that's great. Yeah, we love Dr. Sethi. He's very active with the National Spine Health Foundation and very, very committed to patient education and connection. And lucky you. You got to be in the hands of Dr. Sethi. So, so tell me, so you came to Peace, you did your research, you were referred to a great doctor, you went to the doctor's office. What was it like at your first visit?
My first visit was full of emotion. It was full of excitement, some nerves, of course. And this was just me testing the waters. I really needed to hear, well, is this still an option for me? Because at that point, I haven't talked to a specialist in a long time. It's been years since I spoke to someone who could really take a good look at my spine and say, okay, these are your options. This is what we can do for you. And I remember my first appointment, just being full of emotion. And I was very excited to be there. And as soon as I met Dr. Sethi and his team, just throughout this entire process, I just had so much peace in my heart. And I could tell that they really want to help their patients and they want to see their patients thrive. They want to see them well. And that's the feeling I got even just from my first visit.
That's awesome. That's when you know you're in the right place for you, is you have that good feeling, you feel confident, you have a good relationship with the surgeon and the team.
Yep.
And that point of confidence in the medical team is also another layer of peace that brings you, that you're like, I'm in the right place.
Yes.
So tell me what they did for you, Emilya. What did they recommend?
So, of course, because my scoliosis is pretty severe, it wasn't a very straightforward answer of yes, like we can correct you to 100%. They couldn't promise me perfect results. We're not looking for perfection. That's not our goal. It's to bring as much correction as your body can handle. And they did recommend that I undergo surgery. And they left the timing up to me. And I scheduled for a few months out.
And that is fantastic. So it gave yourself time to mentally prepare, to physically prepare. What kinds of things did you have to think about in terms of what your recovery was going to be like? Did you have to make any special changes in your home or preparations for what things would happen after the surgery?
I knew I couldn't go back to work immediately after surgery, so I needed to take some time off, and thankfully I was able to do that. And I knew that I needed people around me that would physically be able to help and support me. And I had my parents, I had my siblings, my family there for that. I didn't have to change much within my home or my room. I definitely was utilizing a little like the stick that helps you pick things up off the floor, and just
the grabber,
things, the gadgets. Yeah. The grabber.
Yeah. The grabber.
Yeah.
The grabber. Grabber is your friend.
Like that. Yes.
Yeah.
Absolutely. Little things like that. But I didn't really need to make any major changes. It was just taking the time off to be able to recover and heal. right after surgery.
Emilya, do you know what degree your curvature was going into surgery? Did they share that with you?
It was 100 degrees, but it could have been a little more. I've seen some x-rays of mine from previous years where it was around 111 degrees. So I'm not sure if it was just changing, but going into surgery, I believe my bottom curve was 100 degrees. My top curve was around the 70, 80 degree zone, but definitely severe. I only actually know personally 2 others who have curves that compare to mine. Yeah.
It's incredible that you went that long, that you were able to, feel comfortable, for that long as those curves were progressing so severely like that. And so what was the goal of surgery? So you said the goal was not to be perfectly straight, but to be close to straight. So I guess probably didn't give you a number, but just to say we're going to make this better. And so tell us what the surgery was and what the outcome has been.
Yes. I love thinking back on the day of surgery. I know, as crazy as it sounds, it's one of the best days of my life. And I mean that. It was such a fun day. I know fun and surgery usually are not heard in the same sentence together very often, but I don't know what it was. It was, I'm a Christian, and I just prayed over this day for months before going into surgery. And this piece that I talked about from the beginning of the decision to just that day, it stayed with me. I knew I was in the right place, in the right hands. And the day of surgery, I was so excited. So I went in and they got to fuse me, I believe, from T3 to L4.
Wow.
Of course, they did not promise to fully correct my spine because that probably my body wouldn't be able to handle that at this point in my life, but they did such a great job. I have a lot less curvature in my spine. It looks a lot better. And
awesome.
I remember waking up from surgery, and we're all emotional. Most of us are usually emotional. So I remember crying, but I remember crying tears of joy and just understanding, even in that moment, right after waking up, that I am so grateful that I get to be here. And I'm so grateful that the surgery was a success, because I remember asking, is everything okay? And they're like, yes, the surgery was a success. And I just remember feeling so thankful, just crying tears of joy. And I love thinking back to that day. I honestly wish I could relive that day over and over and over again, because it was just such a day full of peace and joy. And I was very excited to be there. So, of course, the day after that is when that initial pain comes on and you realize, wow, this was a big deal. It wasn't a small surgery. It's a complicated, complex surgery. And recovery felt long. It was not easy by any means, but I knew that if others could do it, I could do it too.
I love that.
Yes. And I had so many people around me who were there supporting me. Maybe they couldn't fully understand, but they were willing to try to understand. And I just had all my family around me, all my friends around me, supporting me. So recovery wasn't easy, but I made it. I'm here. And I know, so thankful. And I do love thinking back on day of surgery.
That is the most amazing, joyful thing I have ever heard about day of surgery. I hope you have shared that with Dr. Sethi and his team over there.
I have, and I'm going to continue to. I just loved it.
Yeah, that's fantastic. I think that, that really does speak to, you were ready. You were ready. And you were ready to move on to a new chapter in your life, and you did all the right things for yourself. You did your research, you found a surgeon and team who you felt great about, and got yourself prepared and did it. And
yes.
Bravo.
Thank you.
That is fantastic. I'm so, so happy for you and so excited to share this story with the world because it's so amazing. And you cover so many things, the fear, the confusion, the uncertainty, denial, the mental anguish, fear of surgery. All those things are so real. And then doing your research and finding community. You said you had a friend that had a complicated surgery. That was a really critical piece in your decision making. We tell people often ask us, how do I know if I'm at the right doctor? How do I find the right doctor? And one thing we do encourage people to do is talk to friends and family. Hear from others who've had experiences. Someone knows someone who's had a good or a bad experience somewhere, right? And all of those are data points. Yeah,
exactly. I needed to hear from others. I felt that it was really helpful to hear others' stories. And I remember just throughout the years, I kind of always stayed aware of what spinal fusion is and how it helps people, even when I didn't think that I would ever agree to this for myself. I found it so encouraging and so helpful to hear other stories. And this definitely ultimately did help lead me to this decision for myself, is when I would see for myself just how helpful it has been and just how much change it's brought to people's lives. They're able to do what they weren't able to do before. And there's so much less pain. I mean, just for me, there's so much less pain now after surgery than there was before. And it's interesting because now that I'm feeling like I'm a lot more further along in my recovery, I'm realizing that I was in so much pain before, and it was my normal, it was my reality. So
You got used to that. Yeah, you got used to that.
I did. Yeah, I couldn't really even measure it to anything else, or just understand what it is I was experiencing, because it was just me. It was all I knew.
It's all
being
you knew.
Outside of surgery, being on the other side of surgery. Now I'm thinking, wow, I was in a lot of pain just doing the normal things like sitting in a chair, driving in a car, taking a short walk. It was just the normal things that you would want to do. And I was just in a lot of pain because of my back. But being on this side and hearing that, others were able to have a successful surgery as well, this has been very helpful in my decision-making process. So yeah, you're right.
Well, that's what we do here at the National Spine Health Foundation. We tell these stories so that others can learn and get inspired, get hope that their lives can be improved and can be made better. So what you're doing now is paying it forward, right? When there's someone out there who's going to hear this and say, gosh, I can get better and my life can be better. And, I thank you so much, Emilya, for sharing your story with us and taking the time. It's hard to sometimes share your story. And I so appreciate your honesty and vulnerability that you shared with us today. And I'm looking at the screen as we're talking, recording, at a gorgeous young 20-something-year-old girl with a perfect smile and just beautiful, glowing, radiant young person. And, you just can't believe what you've been through. And, wow, what a wonderful future ahead of you. And, we say thanks to the miracles of modern spinal healthcare, the outcomes are better than ever before in history. Mm-hmm. And you can live your full, wonderful, active life. And it looks like you're on the road to doing just that.
Yes. If anyone is listening and they can relate to any part of my story, I do want to say that there is so much hope. And, you're right. Modern medicine allows us to find relief for our pain, and what this surgery provided for me is something that I wasn't able to even comprehend going into it, but I'm so thankful for the gift of spinal surgery. I never thought I would ever say that for myself, but here I am. So if you can relate, know that there absolutely is hope, and you don't have to live with the same level of pain that you are living with now.
That is so beautifully said, Emilya. Thank you for saying that. I think that, people like Dr. Sethi and Dr. Lenke and so many other surgeons and healthcare providers out there are just absolute healthcare heroes. I mean, they put the best of science into practice to improve people's lives. And we just admire and respect, and they are the heroes,
yes.
in our society, for sure.
Absolutely. Very thankful for them.
Emilya, as we wrap up our conversation here, is there anything we haven't covered that you want to say or that we haven't talked about?
I guess I can say that I'm still on the road to recovery. I did a couple of months of physical therapy leading up to surgery to get strong and prepared. And I am so grateful for that. I think that's really helped me. And I'm actually have an appointment today for physical therapy.
Nice.
So I do want to say the recovery journey is different for everyone. In my case, it was quite difficult, but I saw improvement week by week, and I'm here now, feeling strong. And I know there's there's so much ahead of me where there's even more room for improvement and recovery, and I'm very excited about that. So although it hasn't been easy, it's taken some time for my body to understand what just happened and to get used to my new spine. I'm ever so grateful that I said yes to this, and I definitely can relate to anyone who has scoliosis. We're in this together.
All right. Emilya, did you find the National Spine Health Foundation as a source when you were looking for information?
I did not. I found you guys through Dr. Sethi. It was at a post-op appointment that Michelle and Dr. Sethi said, hey, there's a great resource out there. And I thought, wow, this is amazing. Definitely want to be a voice because I needed to hear from others. And so I'm very glad that I get to share my story on this side too.
That's awesome. I'm so glad to hear that. I'm so glad that they encouraged you to come join us and tell your story and spread the word about the work we're doing. Emilya, it was a delight to meet you and hear your story of incredible perseverance, determination, courage, and taking control of your spine health on your own terms. Sharing your story with the community will no doubt help someone else gain the confidence and fortitude needed to make the right decision for them as well. Thank you so much for being willing to share with us. At the National Spine Health Foundation, something we believe in most is providing hope for recovery through sharing stories of success and expertise. It isn't always easy to find someone to relate to, even though 100 million people suffer from neck or low back conditions every year. To hear more stories of spinal champion recovery and access educational materials about spine health, visit us at spinehealth.org. If you're interested in supporting our show financially, you can contribute at the link provided. Thank you for listening.